Every few days, we see another estimate, another prediction, another threat from the insurance industry that premiums are going to continue to go up at an even faster rate than they've gone up in the past. We know what that means for business in this country. We know what it means for small employers. We know what it means for individuals out of pocket. We also know that insurance company profits since in the last 7 years or so have gone up 400%. We know that insurance companies are getting larger as they've pushed out smaller competitors in region after region and state after state.
In many states, particularly the small ones, there's insufficient competition in the market. Many states, one or two insurers absolutely dominate with monopoly power in the market. And it just doesn't provide small business owners with much choice when we go to buy insurance. This is killing jobs. Small businesses under 100 employees employ 40% of the workforce. It's killing our economic recovery. In the past, small businesses have pulled the economy out of the recession before anybody else.
If the status quo continues, more and more businesses will be forced to stop providing coverage for their workers. Small businesses want to provide the coverage. They know it's good for their workers, good for morale, good for keeping, but they just can't afford it any longer. That's why we need a public option. With a public option, health insurers will finally have a real competitor in the market. They'll be forced to put consumers before profits.
It is not necessary for a public option to extract profit out of the market. In my home state of Rhode Island, just a few years ago, United Health Plan, this is a state of 1 million people, mind you, and it was a state in which United Health Plan at the time only had a 16% market share. Out of Rhode Island, in 1 year, that one company extracted or tried to extract $37 million in profits to export back to its headquarters. $37 million put back into a 16% market share in Rhode Island can mean a great difference in improvement in the quality of care and in cost for those folks. And that's just the profit element. President Obama's own Council on Economic Advisors has recently published a report saying that excess cost in the healthcare system in America is $700 billion a year. If we could only, by improving the business model, get a little bit of that back, it would be an enormous savings and make a big difference. The question ultimately is, can we trust the private insurance industry exclusively to take advantage of this moment and turn the direction of healthcare in those directions? My experience with them is that the answer is no. The track record that they have shown us demonstrates that the answer is no, and I think the public option is critical to taking advantage of all of the other measures that we're building into this healthcare reform so that we can turn this healthcare system around before it creates economic wreckage in this country.
Small businesses need comprehensive healthcare reform now. We need real cost containment. We need wholesale insurance reform. We need tax credits to ensure affordability, and we need the establishment of robust exchanges where small businesses can buy insurance, where there's choice, transparency, and competition, and this includes the inclusion of a choice of a public and a private plan.
So we are working with Leader Reid on getting 60 votes. We think we can do it because it's an important priority, and everyone in our caucus understands if we do nothing, the system will collapse. I am optimistic that we will get those 60 votes. Harry Reid is the best vote counter and vote getter that I have ever seen in my 35 years as a legislator. We're working with him, and we believe we will succeed.